Well, good morning, and thanks for having me and Dr. Daskalakis here in the briefing room today. We wanted to provide an update on the progress we're making in fighting the monkeypox outbreak. As we announced a couple of weeks back, we have ample supply to vaccinate the highest risk individuals against monkeypox. Nearly all jurisdictions have moved toward the intradermal vaccine approach, which means that jurisdictions have effectively transitioned toward an approach that has gotten not only more shots into arms, but also without sacrificing the safety and effectiveness of the Genovis vaccine. In fact, over 70% of all vaccines being administered in the United States today are given intradermally. Our focus now is to reach the remainder of the eligible population where they are, at trusted locations and events across the country. And equity has to be a key point and priority embedded in throughout our response. This past weekend, we saw how successful that approach is. Because of our direct allocations for Southern Decadence in New Orleans, Black Pride in Atlanta, and Oakland Pride, thousands of shots were administered during these events. In fact, over 3,000 doses were administered at Southern Decadence and their affiliated events, and nearly 4,000 doses were administered at Black Pride in Atlanta. That means thousands of individuals are getting the protection against monkeypox that they may not have if otherwise. These events demonstrate our strategy is working. We're also accelerating our effort to provide vaccines to places and people that we know will make a difference. As Dr. Daskalakis announced last week, we are launching a new program that allows local health departments to request vaccines to use innovatively through strategies to reach Black and brown communities. And today, we're announcing that we're providing more vaccines to upcoming Pride events across the country. First to Idaho, where 820 doses will be made available for the weekend of Boise Pride, and second, 10,000 doses to California ahead of the Folsom Street Fair, the Castro Street Fair in San Francisco toward the end of this month. We will continue to pull every lever and meet people where they are to end this outbreak, and we're already seeing progress, as Dr. Daskalakis will brief out here in a little bit. Sir.
Thank you, Bob. We are encouraged by the progress that we're making right now. You'll see the chart to my left. We only have data from 35 jurisdictions. That's just over half of all jurisdictions that are directly receiving vaccine. But over 460,000 doses have been administered. Keep in mind, the population at highest risk is approximately 1.6 million people right now. So even with this partial view we have now from the reporting jurisdictions, we're seeing strong progress really getting shots into arms. So now that supply is less of an issue, we need to make sure we focus on maintaining demand by making sure that people know that effective and safe vaccine is available for those that could benefit. Alongside our vaccination efforts, we've scaled up access to testing and treatments, as well as ensuring that LGBTQAI+ individuals know how to reduce their risk. Together, those efforts are leading to positive trends in the data that CDC has collected over the last couple of weeks, especially in our hardest hit areas. So as you can see, the week-over-week growth rates of the virus, meaning how quickly the virus is spreading, is trending downward in some of the areas involved earliest in the outbreak. Places like New York, California, Texas, and Illinois are all seeing significant declines in growth rates over the last month. To put a finer point to it, back in July, CDC estimated that it took 8 days for cases to double nationwide. By mid-August, the doubling rate was 25 days, showing encouraging signs of progress. The positive trends that we're seeing in this data also speak to the actions that individuals have taken across the country to protect themselves against the virus. That includes changing their behaviors and seeking out testing and vaccines. But the data also underscores the fact that we cannot be complacent and we must aggressively continue our work to get clear prevention guidance and vaccines out to individuals in communities where the virus continues to spread quickly, and those places and individuals that may face barriers in accessing testing, treatments, and vaccinations. So that's why our approach centered on increasing vaccine access, including through equity interventions and event allocations in partnership with our outreach and engagement efforts, will continue to be critical as we fight this outbreak. Thank you.